The next speakers are patient-focused nutrition and mental health, Kristen Holm, who is a marriage and family therapist at National Jewish, and Michelle MacDonald, who is a dietitian. Could I ask the speakers both to come up? Okay. Oh, there's one.
There's one. I was lurking. And I'm Kristen Holm. I'll just use that to advance.
You can, or you can use this wireless if you'd like. Just hit the button right there.
Thanks. All right, well, thank you everyone for having me here to speak, and thank you to Amy for asking me to come today and speak about mental health. So I'm an associate professor at National Jewish Health, and I also work as a consultant for AlphaNet, which is an organization that does work related to alpha-1 antitrypsin deficiency that's been referred to and discussed today. Oop, yes. Main topics that I plan to discuss. So I'm going to focus on depression and anxiety in terms of mental health because depression and anxiety are so common and they're also treatable, which is good news. So I'll talk a little bit about recognizing symptoms of depression and anxiety, thinking about when to seek treatment for depression and anxiety, and then what the treatment options are. So frankly, symptoms of depression and anxiety are part of the human condition. I experience anxiety about speaking in public. So all of us experience symptoms of depression and anxiety from time to time. And so really a relevant question becomes, how can you distinguish normal fluctuations in mood from diagnosable depression and anxiety? So here's a laundry list of symptoms of depression. I'm not going to read them all off. But to qualify for a formal diagnosis of depression, someone would need to endorse 5 or more of these symptoms. During a 2-week period, all the symptoms occurring all together during a 2-week period, and at least one of those symptoms needs to be one of these top 2 listed that are italicized and underlined. And so you'll note that there's, given that people have transient feelings of feeling depressed or sad, there is an effort here to kind of define the threshold. So it's depressed mood most of the day, nearly every day, and again for at least 2 weeks. So hopefully that gives you some sense of persistence it being required in order to qualify for a formal diagnosis of depression. Or the other cardinal symptom up here is the decreased interest in or pleasure in activity, so an inability to experience or feel pleasure. So that's for depression. For anxiety, again, there are these cardinal symptoms that are at the top. So in order to qualify for a formal diagnosis, someone would need to feel excessive anxiety and worry about a variety of events and situations, more days than not, for at least 6 months. So again, getting some sense of threshold. So it's worrying about a lot of things, a lot of the time, for a fairly long time, six months, and then having difficulty controlling the anxiety. And then with these additional symptoms, someone would need to endorse at least 3 or more of those additional symptoms. Another caveat is that the symptoms do not count if you're experiencing them due to your medical condition or the medications you're taking to treat your medical condition, which is really relevant with both depression and anxiety. Fatigue are mentioned in the laundry list of symptoms. Well, fatigue has been discussed today as you know, it can be a symptom of underlying lung condition, it can be a side effect of medications, and so it can be really challenging to tease out, you know, what's the cause or the primary cause or what are the multiple causes of fatigue. And so it can take some work to try to tease out whether these symptoms are really better accounted for by something other than depression or anxiety. So back to that idea of how can you distinguish between normal depression or anxiety and a clinical problem. And one way of thinking about it is you can go there, just don't park there. All of us go there from time to time, but you don't want to get stuck. You don't want to park. So how do you know if you have parked there? A key way of thinking about it is interference. So if those symptoms are interfering with your ability to do your work, engage in activities, be really engaged in your relationships, that's a real clear sign that you're crossing a threshold. And always, when in doubt, you can always seek evaluation and treatment. That's always a good idea. So treatment options, there are two main options for treatment. So they're both shown on here with pictures. So there's medications that treat depression and anxiety. It's these happy pills. And then also talk therapy is an option. Although I must say in this photo, it's a little disturbing that the woman who looks like she's a therapist looks really shell-shocked. So if you do engage in therapy, I hope your therapist doesn't give you that look. But on average, research shows that for mild to moderate depression or anxiety, both medications and talk therapy are equally effective. So either one of these roads is a good option. And research also shows that combining medications and talk therapy is more effective than one option alone. So they're by no means mutually exclusive, and in fact, research would indicate that pursuing both roads simultaneously can lead to additional benefits, so that's worth keeping in mind. So should you decide that you want the happy pills, how can you get access to them? So medication options, talk to your physician. Primary care physician is an excellent place to start. The vast majority of medications for depression and anxiety in the United States are actually prescribed by primary care physicians. So that is an excellent resource. If your pulmonologist is the physician that you work with the most closely, it is possible that your pulmonologist might be comfortable prescribing one of these medications, and then a psychiatrist is the physician who really specializes in these types of medications. If you wanted to find a talk therapist, you can contact your health insurance agency because these services are covered by most health insurance plans, and the keywords are to ask for a behavioral health or a mental health provider. And then these are professional organizations of therapists, and all of them have, for all of these I've listed a website and a phone number. With the websites, you can go in and find a link where something along the lines of find a therapist, and you can put in your zip code and search by zip code to find somebody who's near you. So if you live in a large metropolitan area, you could probably find a whole list of people within 5 or 10 miles of you, and you may need to search within a 50-mile radius depending on where you live. But all of these are good options for how you can find somebody to work with. And I really did keep this brief. This is the last slide. And really, these are the main points. So if symptoms of depression or anxiety are interfering with your life in any way, seek evaluation and treatment. And treatment options are medications and talk therapy. So 2 different roads, but you can go down one or the other or combine them both. Now maybe we're back on schedule with it being that speedy. Next up, without further ado, is Michelle.
And I will say that some patients that we see, the main reason they're not eating is because they're depressed. So sometimes my job is just to give them some hope and inspire them, I think, as a lot of other providers do, because then you'll eat better. So I am one of the dietitians at National Jewish Health. Thank you, Amy and Phil, for inviting me. I actually feel completely honored and humbled to be in the presence of such amazing providers and professionals. I've been working at National Jewish Health for about 9 years, so I've seen a lot of the NTMers, and I had one patient come up and say she was in my class, so that was nice. Okay, so just an introductory quote to the patients here. I do want you to know that what you eat does make a big difference, and to the providers here, I wanted to make a plug for nutrition counseling services. Your patients might really benefit from nutrition counseling, either from a dietitian in your office, and I work in the clinic with the National Jewish Health providers, Or if you need to, make a referral, because dietitians can really emphasize the importance between adequate intake and weight and how well a patient can fight an infection. And we can also just give them really specific input on how to eat to manage or restore their weight. I think we actually have really good luck at National Jewish getting people to manage their weight. It's especially when we try and get people to gain weight, which, believe it or not, can be very hard for some people fighting an infection. So in terms of an overview, we're just going to look at 4 things. I'm going to just remind you that nutrition is more than just eating for pleasure. It is a therapy. And we'll look at kind of a global bird's eye view that infection and malnutrition are related. We'll look at how you should eat as a patient. That's a question I get a lot. What should I be eating? How should I be eating? And we'll touch on reflux. So one slide regarding a reminder, nutrition is a component of your therapy. It is how you take care of yourself. If the mycobacterial disease is eating your lunch, literally, because it's using your energy and it's using your reserves, then eating well gives you the energy to breathe, to cope, and especially in bold, to fight infection. There's a direct relationship between what you put in your mouth and how well you can fight your infection in your lungs. It also helps you focus, think, manage your weight, move, and more. And so I think my point here is that food is part of your fight, and you should see it that way. Food is something you can use to help you fight the mycobacterial disease. So let's take a bird's eye view. This is the second part of my talk. We're going to kind of take a high-level approach to this. There is a very intimate connection between infection and malnutrition. So infection's at the top, and the point is, and malnutrition is at the bottom, but they are connected. And so the point here is that if you have an infection, you are at risk for losing weight unintentionally. And how that works is that the infection actually alters your metabolism. And what happens is your metabolism shifts and you lose your appetite. That's actually has direct relationship to the infection. You might have a fever, which is going to make you burn more calories. And additionally, you might be coughing a lot, which burns a lot of extra calories. And then secondly, you may have muscle and fat breakdown, and I'm going to underline this point here because basically your metabolism is altered. Your body is prioritizing what's important, and it's deciding that fighting your infection is the most important thing, so it puts everything else on hold. Instead of building up your lean body mass or repairing it, it's not doing that anymore. It's actually breaking down the proteins in your muscles to, number 1, create energy to fight your infection, and number 2, to get building blocks to make immune responders to fight the infection. Same thing is happening with your fat stores. So what you can see, and this doesn't happen to everybody, but some people experience a wasting syndrome, which means you basically waste. And I can compare this to tuberculosis, which was known as consumption. Tuberculosis was such a severe infection that it would physically consume the people who had it at the most severe. So the same thing can happen with mycobacterial disease, and I see this a lot. Again, it does not happen with everybody, but this is where a dietitian can really come into play, I think, because people need to realize that if they don't eat, they will waste away or can waste away. So other alterations, you might see nutrient loss. You might also see malabsorption. And so all these things are a sequelae from the infection. This can cause basically malnutrition. You can see unintentional weight loss. You can see this muscle and fat loss, and you can actually see it on people's bodies. And so if you've noticed that your eyes are more sunken, or if you've noticed that you have prominent, temple area, or maybe your clavicles are protruding more, your back looks really bony, or you can see your rib cage, or your quad muscles are like really not very big anymore, those are all signs of wasting. And in theory, you can actually restore that if you're able to fight some of the inflammation with the right medication regimen and eat. You have to eat to replace it. You might also see micronutrient deficiency. And then my point here is if you're malnourished, your immunity is going to be lower. So you're at higher risk for getting another infection or just not being able to fight your current infection. So you cannot go there. And this is what I talk to my patients about. You need to eat to be as strong as possible in order to not get as many infections and to be able to fight them off, because you don't want to get into downward spiral where you're so malnourished that you're in a life-threatening situation, which unfortunately I've seen, and it's sad. Okay, so third part of the presentation is how should I eat? And the one word that comes to mind is you should eat purposefully. You should take food like it was medicine. I had a patient say, so food is my drug. Yes, it is like a drug in that it's therapeutic. You should take it by the clock on a schedule and don't miss a dose. So regardless of whether or not you are hungry, you need to take food, just like you would take a pill. You plan it and you take it. Don't wait until you're hungry to eat. You nibble often. If you don't eat, you waste away. And then a few other tips are to choose favorite foods any time of day. You can eat breakfast for dinner. You can eat dinner for breakfast. Just eat. Eat when you have more energy, which for some people is earlier in the morning. And keep snacks handy. Also, other descriptions, I always tell people you've got to eat regularly. This is such basic advice, but I can't tell you how many people I meet who don't eat regular meals, or if they might eat 1 or 2 meals a day and they don't snack because that's just not how they were brought up. But you do need to eat, in my opinion, breakfast, lunch, and dinner, and in between. It's like a prescription. That's your eating prescription. You need to stop skipping meals. So if you've never eaten breakfast, now is a good time to start. You can train yourself to eat just like you can train yourself to take a medication. And then I make it super quantitative for people. I try and make this very calculating so people can do this so they can really put some effort into it and I can hold them accountable. So first thing I do is I say, okay, if you need to gain weight, let's look at your baseline diet. We need to keep that the same, but then we need to add about 250 to 500 calories to your diet every single day on a consistent basis. So what does that look like? Might be a half a cup of nuts. That might be close to 200 calories. With some fruit with that. It might be a couple tablespoons of peanut butter, which is 180 calories, and some crackers. It doesn't have to be a Thanksgiving feast. You can do this with small mini meals if you need to. You can do this with a nutrition supplement or a bar or something extra, just something extra here and there over the course of the day. You might need as many as 2,200 or 2,500 calories a day to gain weight. That's a significant amount. It takes effort. It means you can't just eat a piece of dry toast for breakfast. You've got to do something that has a lot more punch to it, has more impact. You might need 75 to 150 grams of protein a day. That's a decent amount. So the serving size of chicken Parmesan for lunch was maybe 3 ounces. That was maybe 20 grams of protein. The serving of fish at lunch was maybe 2 ounces. So if you just took 1 serving, so that's maybe 15 grams. So you've got to eat at least, I usually say 4 ounces the size of my hand when you do chicken, fish, or meat, or seafood, or turkey, or something like that. If you're doing eggs, you have to do at least 2. If you're doing nuts, you have to do at least 1/3 to 1/2 cup. If you're doing peanut butter, it can't be a thin spread. It has to be 1 or 2 tablespoons. You have to go big. You have to go big. So additionally, there's some decent evidence that 30 grams of protein at each meal might actually stimulate protein synthesis. So again, that's actually not an insignificant amount. 2 eggs is only 15 grams, so you have to do 2 eggs and something else with that. And you might need some supplemental sources, whether that's Greek yogurt or cottage cheese or a protein supplement or something like that. But I encourage people to count, because when you count, you get to where you need to go. Okay, so this is just a little bit more emphasis on what it is you should be eating. We're looking for high calorie, we're looking for high protein, nutrient dense. We're trying to avoid unintentional weight loss and muscle and fat loss. We're trying to get you your nutrients back, and this will directly relate to how well you fight that infection. Okay, so I have a little gallery. I just wanted to bring it to life a little bit. I have the information on the side as to what this is, but we're looking at full-fat Greek yogurt with granola, or oatmeal with a lot of nuts and some sugar. That's my typo for the day, and fruit. Not sugary breakfast cereal. So this is lightweight, and there's very little protein in it. So if you want Lucky Charms, have it on top of your granola or something. Make it, add it some flavor, but it can't be what you're eating. And no low-fat milk. And don't do low-fat products. You need to change your mindset in terms of what's healthy, and you may need to really bend towards the high-fat products. That's completely okay. If you do toast, it should be thick. If you do peanut butter, it should be thick and add some honey on top. We can't be doing the dry toast. That's going to get you nowhere quickly. You could do the egg avocado toast. That looks delicious. You could do an omelet with cheese. You could also put some chicken sausage there if you want it. And we need some starch there. So we need some toast or we need some potatoes. We don't want to be doing a lot of the things like Pop-Tarts. I hear that a lot. They're convenient. And I'm okay with Pop-Tarts as long as you've had your omelet and your toast already. This gets to go on top. It gets to be the icing on the cake, or you could do half a donut or something. Everyone has room to eat this. You know, I kind of like to say everyone can find like an extra part of their stomach to fit this stuff in, but you've got to eat your nutrient-dense stuff first. For lunches and dinners, look at chicken, fish, or meat and do a generous portion size and maybe roast it in oil or put some pesto on it for flavor, get some fat on it. Same with the vegetables. Here we just have potatoes, but in theory you could do potatoes and roasted vegetables. So douse a ton of oil on it, put some garlic and herbs on there, make it taste good, make it heavy. The ham sandwich is not going to cut it. I can't tell you how many times I hear that people eat like, you know, sometimes it's even only one slice of bread and one slice of ham and one slice of cheese, and there's no way you can meet your needs or restore your weight with that kind of a meal. You could do something heavy like, you know, the whole meat and potatoes approach always works with gravy. Not too much salad, because this is fluffy and it will fill you up. So I'm okay with a little salad if you want to eat your heavy meal first and then eat a little bit of salad on the side. Or if you want more vegetables, like I said, grill or saute or roast them in oil and then cook them down, and then you'll get some calories with that and pair it with a good protein. Okay, so lastly, we'll just address reflux. The condition essentially is the backflow of fluid or food from the esophagus or the stomach. And what I like to point out are a couple of things. One is that you can reflux both during the day and the night. Because you're active during the day, that actually there's a lot of pressure on your internal lower esophageal sphincter, and so that pressure is going to promote backflow during the day. Of course, when you're at night, you're lying down, so you might also be at risk for reflux then. But keep in mind it can happen both during the day and the night. And your PPI medication, your proton pump inhibitor medication, or your H2 blocker medication, we're talking about omeprazole or maybe ranitidine or something like that. Those medications do not reduce how much backflow is happening. They only reduce the heartburn or the acid burn that you might feel. So the reflux is still occurring, therefore you still need to take precautions. So if you have reflux, and most people do intermittently or episodically, both during the day and the night, then you're at risk for aspiration, which is the entry of fluid or food into your lungs. And this can basically, in turn, increase your risk for the development of or exacerbation of your lung condition. So reflux precautions are something that we use because they may be protective, and they're not a medication. They don't have medication side effects, so why not do this to increase your margin of safety? So in terms of what has been shown to reduce reflux events in the literature, we know that if and only if you're overweight, then we want you to lose weight. We don't want you to lose weight if you're already thin or underweight. So we would just tell you to avoid overeating and follow some general overweight precautions. Elevating the head of your bed has been shown to reduce the amount of reflux events that occur. So we typically like to see 30-ish or more degrees if possible to get your head up. We like to see you sleeping on your left side versus your right side. And we prefer you eat earlier in the evening. Try and stop within 3 hours of going to bed. So people want to know what they can drink and eat. So some of the safe beverages are anything that's caffeine-free, either coffee or tea, low-fat milk, whether it's cow or plant-based, non-citrus juices, and water. What you should try and avoid are these, and it's the bigger list, but the items in orange are the ones that have been shown to promote reflux. So alcohol and carbonated beverages are probably my top two there, but anything caffeinated that includes decaffeinated coffee and tea, because there is some caffeine in that. And then chocolate and mint flavors, citrus juices, energy drinks, because they're carbonated and caffeinated, sodas, and vinegar. People do drink vinegar. That's not recommended if you have reflux. So what can you eat? Everything that's nutrient dense, all your proteins, as I mentioned, good whole grains, non-citrus fruits, and there's lots of those, especially with the summer coming up. There's berries, etc. Vegetables are allowed, just not your hot peppers. And same with herbs and spices, just not your hot peppers. In terms of foods to avoid or limit, again, I have the ones that I think are probably more problematic in orange. Chocolate, and then all the other ones in orange are high-fat foods. The idea is high-fat foods might empty more slowly from your stomach, so try and pick the lower fat options of your meats, of your dairy, and your sweets. Try and limit the portion, and then try to avoid fried foods. And then the other ones are hot peppers, ketchup and mustard, mint candy, mint gum, spicy foods, tomatoes and tomato sauce, and vinegars on that list too. And lastly, I was just going to give you a couple of resources. I think the Harvard School of Public Health has the best portal online for nutrition information, so I refer people to the nutrition source. And if you're looking for a local dietitian, you can use the link basically from our professional organization to find a local dietitian in your area if you are interested. And I think we've done it. We're done. Thank you.